Viewer discretion advised.
Ladies and gentlemen, are you ready? Ladies and gentlemen, please give a big round of applause for your host, Michael Dane. Michael Dane.
Hey, how's it going? Thanks for checking out the show. This is the Valento Show. I'm Michael Dane, your host. And this is incidentally the very first show of the Valento Show. This is the Fuck Cancer Show. Sorry about the language. Gotta understand that the Valento Show is raw, real, uncensored, no bullshit here at the Valento Show. I tell it like it is. All right, so this is the Fuck Cancer Show, and we've got a very special guest on the show, and she's going to tell us her story. And for those of you that are cancer-free, congratulations. Stay strong. For those of you that have cancer that are watching this right now, stay strong. Don't give up the fight. Everything's going to be just fine. All right. Let's get to the show.
And now, on with the show.
You are watching The Valento Show. This program is intended for mature audiences only.
Hi, my name is Lori and I've been cancer free since 2020. So in 2018, I went in for my routine mammogram and they saw something that looked a little bit suspicious. So they sent me to have a biopsy. The biopsy came back negative. It was just a like a tissue granuloma type thing, nothing to be concerned about. So after stressing over that, everything came back negative. 2019, I went in for my routine mammogram, and again, they found something in the right breast that looked suspicious. So they did a biopsy, and it came back that it was cancer. Now, I wasn't very scared at that point in time prior to the diagnosis because I thought the year before it came back and it was negative, so this would be the same thing. So my mindset was completely different. Then when I got the words that you have cancer, it's kind of when everything changed. It didn't really hit me right away. I think I was just kind of in denial and not really accepting of it. But after the diagnosis came, I was told that it was a very aggressive form of cancer. It was in stage 2. It was what they call a triple negative. They recommended that I go through genetic testing with my daughter to see if she would be a carrier of this particular gene. That turned out to be negative, so I was very grateful for that. Then I got a team of doctors together, including plastic surgeon, general surgeon, chemotherapy or oncology doctor, and they pretty much set the course for what my treatment was going to be like and what the next years of my life would be like. So I received the diagnosis right around the July 4th time frame, and by the end of July, I had started my chemotherapy treatments. They started out one treatment once a month for 4 months. Reason being that it was so few and far between instead of weekly was because the chemotherapy that I was receiving was a very, very high dose. And it just was a lot of chemotherapy at one time, basically.
How chemotherapy works. Chemotherapy, sometimes called chemo, is a cancer treatment that uses drugs to target rapidly dividing cells throughout your whole body. Chemotherapy can be given in different ways, such as into a vein or by mouth. It kills cancer cells, but it also damages healthy cells. Different chemotherapy drugs treat different cancers. Your healthcare team will create a treatment plan just for you based on your health and the cancer. You may have more than one chemotherapy drug. This is called a combination. Combinations often work better than a single drug, but they also damage more cells and can cause more severe side effects. A course of chemotherapy is made up of several cycles. In each cycle, you have treatment and then a rest period. For example, a cycle may be 3 days of chemotherapy followed by 25 days of rest. During the rest period, your healthy cells repair themselves and your body recovers, but cancer cells can't repair themselves, so they die. The number of cycles and the length of each cycle depend on your treatment plan. You'll have blood tests before starting treatment to see what your normal blood counts are. Blood counts show the number of different blood cells. Chemotherapy kills blood cells, causing your blood counts to drop. But as you recover from treatment, they usually return to normal. Doctors will order blood tests throughout your treatment to see how chemotherapy is affecting your organs and how well your body is recovering. The timing of your blood test before each treatment is important to see if it's safe for you to have chemotherapy. If your blood counts are too low or your organs aren't working well, your team may delay chemotherapy or reduce the amount you are receiving. It's important to go to your follow-up appointments during chemotherapy. Ask your doctor questions and tell them your concerns about treatment or side effects.
In fact, when they came with bag the first time to hook me up through my port, they laughed about it. The nurses did. I mean, not mean or anything, but they said, people refer to this as devil's blood. And I kid you not, it was the darkest red I've ever seen in my life. And all I could keep thinking, knowing that was going into my body, and it was pure poison, but yet it was to kill a poison inside of me. Until you're actually there and you're going through that, you don't know what to think. You don't know what to say. You don't know how to react. I basically went on autopilot, I think is what happened. I'm like, I don't have a choice. This is what I have to do. There never was a question in my mind, what if I didn't do treatment? I knew I had to do treatment. There just was no other option, because if not, if it had spread to level 2 within a year's time, probably the outcome wouldn't be too great. And I knew I had to be around. And so I started my chemo. They said, you'll lose your hair with this type of therapy, but maybe the first couple treatments, you'll lose it. Well, after my first treatment, I went in to take a shower, and my hair fell out in clumps. And I can't explain what that was like, because to have hair all your life, and I always thought, two things were my assets in life, because I had never been thin, I had never been good looking, but my breast and my hair were always like two of my best assets. And in the flip of a switch, I lost both those things ultimately. So my hair went, and that, I didn't know how to react to that. I didn't know what to do. I didn't want to go out in public. I didn't want to see anybody. I didn't want to talk to anybody. I thought, oh my gosh, you look like a freak. Just a million things went through my head. And I just kind of had to regroup and get myself together and say, it's hair. It will grow back. The end goal here is that you're make it through cancer, and you survive and you live. Hair is just that. Hair will grow back. So having said that, I made it through that. But then I had 6 more months of chemotherapy ahead of me. And I continued to work, and I worked as much as I could up until the point that I could work no longer due to my doctor's recommendation, or I don't know, I guess you'd say recommendation, basically orders. But so backtracking to the chemotherapy, I started out with one treatment, which lasted 4 hours, and that was once a month for 4 months. After that, my treatments went to once a month, not once a month, once a week. And that lasted till the end of 2019. Right around Christmas time, I had my last chemotherapy treatment. And a month prior to that, my oncologist said that your numbers are not looking good. And if you don't stop working and you don't start resting, all the work that we've done until this point will be for naught. And you don't want that to happen. So I stopped working. Now what am I going to do? I've got all day and all night to think about this. Well, just accept it again, and you remember what the end goal is. And the end goal is to survive this and to be there at the end of your journey. So you follow the doctor's recommendation, you do what they tell you to do, and each day is something different. You don't know how you're going to feel. You don't know how you're going to react. Are you going to be tired? Are you going to be vomiting? Are you not going to want to eat? I mean, many things happen to me in my body, psychologically and physically. And although as a whole, I didn't think it was as bad as I heard people always tell me about chemo. But then again, I wasn't thinking about any other options. So I finished the chemotherapy. Then in 2020, I was scheduled to have my first surgery, which is the double mastectomy. I went into the hospital. I had it. I had a little bit of complications at the end with them keeping me an extra night. I had some issues with my kidneys not wanting to restart again after being put to sleep during the surgery. And I also had some issues with my balance and dizziness and standing up on my own, those types of things. But they just believed that that was due to the, sedation that I was giving during the surgery. So I stayed an extra night, went home, and I was scheduled to have one more surgery. And that was to put the breast implants in, because I elected to have breast implants put in. And so I'm trying to heal from this. During this time that I had the first surgery and before I had the second, that's when COVID hit. So not only am I dealing with this situation, now I have COVID, which nobody knew anything about. Nobody knew how it was going to affect anyone. And right during the midst of it all beginning and no one knowing what's going on anywhere, whether it be doctors, people, whatever, I had to go in for my second surgery because this all had to be timed out. So a scary part for me was being dropped off at the front entrance of a hospital and going in there on your own, not knowing, anything could happen. Nobody could be in there with you that you knew. No family, no friends, no nobody. Just the patient was allowed. And of course you had to wear your mask and such. So I go in there alone and I come out alone. And you're just at their mercy. You're at their hands, and you put your faith in the staff that's there, that they're going to take the best care of you possible. And you're going to wake up at the end of it, and whatever you went in there to have done is going to be done. So I went through that process, got the implants. Right from the get-go, there was issues. There's drainage tubes that come with those. And while I was in the hospital the first time after the double mastectomy, I had issues with those tubes. Well, I continued to have issues with those tubes. So it kind of prolonged my healing process. But nonetheless, some days were good, some days were bad. And I just kind of went with it. And then after I got done, before I got done with that, once I had the breast implants put in, I ended up waking up one day and I was taking a shower and I noticed underneath my right breast something that looked very strange. There's a big black, I didn't know what it was. I just didn't know what it was. And so I went and asked my mom, I'm like, any idea what this is? She's like, I have no idea, but you better contact your surgeon. So, of course, they didn't want to see people in the office because it's, again, during COVID. So it was all communicated back and forth via your cell phone. She said, take a picture of it, send it to me. I'll take a look at it. We'll see what we're dealing with. Well, I took the pictures. I sent it to her. And within a half an hour, she said, your implant has bursted. It's infected. It has to be removed, and you have to have another implant put in. So here I go to another surgery where nobody could be there. And this was even worse because I was so scared of just what was happening, not to mention the fact that I couldn't have anybody with me. You don't know what that's like until you go through that. It's a very scary feeling. But again, the end goal was to make it through and to be alive. And after my first surgery, the surgeon did come back and said that we, by biopsied all the lymph nodes and are happy to say that you're cancer free. So 4 years later brings us to today, and I am happy to report that I am still cancer free. And not to lose sight of that, but there are so many things that you go through during a process like this that you don't ever take the time to stop and think about. And nobody tells you how it's going to be. They give you a general idea of what you can expect to go through, but everybody handles everything differently, like everything else in life. You know, you're individual, you have your own body, your own makeup, and nobody knows how you're going to handle it. I thought that I did very well in making it through the surgeries, the infections, the tubes, the chemo, the everything. Never thinking that as a result of those months and months of all that chemotherapy, that I would have lasting effects of things that I never knew were even possible. And what I mean by that is that as a result of the chemotherapy, I have peripheral neuropathy in my hands and feet. And many people don't understand what that is and how painful that is.
Peripheral neuropathy is a painful condition which affects the extremities. It is a type of nerve pain or neuropathic pain where there's damage and or dysfunction to an element of the nervous system which leads to hypersensitivity. How does that translate? Well, patients will come along and generally speaking the peripheral neuropathy will be in their feet and ankles, and patients will describe nerve type pain. So they may have burning, sharp, lancinating, really unpleasant types of pain, electric shock like pains, that sort of thing. When you assess the patients, we need to find out, is there an obvious cause for their peripheral neuropathy? The major things we're looking for in a patient's history are they diabetic, is one of the number one ones. And actually, sometimes diabetes presents with peripheral neuropathy, so it needs to be excluded. Does the patient have a vitamin deficiency, a B12 deficiency? It's quite common. Are there any other causes for the neuropathy? Have they had trauma to the feet, surgery, that sort of thing? Or do they have vascular insufficiency is another significant cause. It's a very painful, unpleasant complaint, and once we've assessed the patient, we will do a full history and examination. The history will consist of a pain questionnaire which we send out, and we look at the characteristics of the pain, site, character, duration, radiation, aggravating, relieving, associated factors. We'll look at the previous treatments that the patient has had, and any investigations that they've had, and then we can assess the condition as fully as possible. Now, it's very important when patients have peripheral neuropathy to find out if there is an underlying cause to that, as we've previously discussed, and that will usually require further investigations, usually blood tests or radiological investigations such as MRI scans, to find out, is there an underlying cause, because that needs to be tackled first. Then we will move on to how do we actually improve this patient's symptoms. When we're dealing with peripheral neuropathy, as I mentioned before, it is a type of neuropathic pain or nerve pain. The mainstay of treatment for all types of neuropathic pain is medication, and the medications that we use are called anti-neuropathic medications. They all tend to have started off life treating other things, so we use anti-epileptics, we use antidepressants, we use anti-arrhythmic medications. And the general principle is to use small amounts of the medication to slowly escalate the dose and to balance benefit in terms of pain relief with any side effects that the patient may experience. Always, optimizing medication is the most important treatment option. We do have other treatment options beyond that. For example, we can do pulsed radio frequency treatment, which I will speak about in another video. We also have advanced pain management treatments, and we can offer spinal cord stimulation and dorsal root ganglion stimulation. Now, these are advanced treatments, and these are only suggested once all the usual treatment options have been explored. The other thing that we do with patients with peripheral neuropathy, firstly, we need to break the cycle of the pain, improve the pain, and get the symptoms under control as much as possible. But we do need to rehabilitate the patient as well, and that will be physical rehabilitation, usually under the care of one of our pain physiotherapists, and that will include strengthening training, aerobic training, but also for peripheral neuropathy, we teach desensitization exercises. Now, these are external physical treatments which the patient can do themselves on a daily basis, and they're there to try and retrain the skin and to try and help reduce the overall pain levels.
So I've been through all types of treatments and pain doctors and acupuncturist and Chinese acupuncture, and you name it, I've been through it, and it doesn't work. It's a pain that won't ever go away. I'll be stuck with it for the rest of my life. Again, not losing sight of the fact that I'm still here. Then what had happened was I started losing my teeth. They would break and they would fall out, and I have no idea what was causing this. And went to the dentist. They said what happens is some people, when they go through chemotherapy, their body doesn't produce things the same way. And as we know, chemo is a poison, and it's a poison being put into your body. It kills the good things and it kills the bad things. And sometimes it kills things that you don't want killed. But yet you got rid of the cancer. So that's your trade-off. But what happens is your mouth doesn't produce saliva and stuff the way that it used to. So you have severe dry mouth. And as a result of that, the enamel on your teeth start to break because there's not enough moisture and stuff inside your mouth. And as a result of that, I started losing my teeth. So now here we go, another issue to go through. So months and months of this and losing my teeth and getting fit for dentures and just a whole nother area that I had to go through that I was not expecting. But I got through it. My hair started to grow back. It did not grow back to as I wanted it to grow back. It's very thin. It's very, very kind of like baby hair. It's very fine. There's no body to it at all. The top, I mean, there's hardly anything up there. And so I went and purchased a wig and got fitted for it. And I wear that when I go out and about or if I go into work, those types of things. But it's very hard for me to get used to wearing that because I feel like everybody looks at me when I wear that wig. And I feel like everybody looks at me when I don't wear that wig. So it's just psychologically, it's a very different journey that you experience. And there's no two people that probably experience the same things. But the good part, like I've mentioned, is I am 4 years cancer-free. They still keep an eye on me because with the particular type of cancer I had, they feel with what their past has told them and stuff is that you're kind of not out of the woods until you hit your 5th year. It's not to say that you could get cancer again after the 5th year, but you won't get it in the same place. If you were going to get it, you'd get it somewhere else.
Hi, my name's Shannon. I'm 59 years old. I have 3 children, 2 8-year-old twin granddaughters. I love riding my bike. I love gardening. I like knitting. I started smoking when I was 13. I smoked till I was probably 45. Barbara and I, my best friend, have been friends since our kids were in kindergarten. She unfortunately passed away almost 3 years ago from lung cancer. She never really had any symptoms in her lungs of the lung cancer. And after she passed away, I saw BC Lung Screening Trial, and they were looking for candidates. I went for CT scans, and one of those CT scans showed a small dot on my lung. And then they did another one and noticed that it had grown quite quickly. They knew that something was going on. That day, I was losing my mind, to be honest with you. I was driving, I was hysterical. Talking to my daughter, I was hysterical. In the hospital for 4 days. They removed the cancer, which was the size of a dime. Because of the early detection and the CT scans, they were able to find it at such an early stage that all that was required is the removing of the cancer. I know it's scary and nobody wants to be told they have cancer, but if it's detected early enough, then the chances are they could do something about it. It's now going to be available in BC to get screened for lung cancer. It's a silent killer, and honestly, it could save your life. It saved mine. Go get screened.
So my name is Rima Batra. I am a medical oncologist, hematologist, and I treat all cancer types. I see blood disorders. One of the most common cancers I see and treat is breast cancer. It was a busy time of the year. It's always very busy at work, and I had to do my mammogram. So I thought I would be in and out in 20 minutes like I always had been, but this time was different. After the mammogram was done, on the first pass, the radiologist came in and asked me to do ultrasounds of both sides. And on that ultrasound is where they found a tumor. And this is when I started to worry a little bit. At the time of the diagnosis, my kids were 7, about to be 8. So I had to tell them things in a simple way. I didn't tell them right away because the day I found out was December 23rd, so I didn't want to ruin Christmas. After we went through those festivities, I did sit them down and I explained that I would need surgery because I was sick. The biopsy was initially an invasive ductal carcinoma and a very slow-growing appearing tumor, so it was a very favorable looking tumor to begin with. But you don't know your stage until after your surgery. Because I was diagnosed at such an early stage, I didn't need a big surgery, and so my recovery from that was very fast, and I didn't need chemo. So my kids never really saw me looking like I was going through something very severe, and I'm glad for that. I can 100% say the mammogram saved my life. We are such busy women. We take care of families, we have work, we have social lives, we have hobbies. Make time for your medical care because it can change the entire course of your life in just a matter of 30 minutes.
So as I went through, as I explained earlier, the process of the peripheral neuropathy and the pain involved with it, and trying to find ways to be able to calm my nerves down and the pain enough at night so that I could sleep. One of the nurse practitioner oncologists that I would see, he suggested medical marijuana as a possibility.
More patients are asking about using medical marijuana to help ease symptoms from cancer and cancer treatment. Marijuana's come a long way. Remember these guys?
Dude.
The medicinal compounds in marijuana come from the leaves and buds of the cannabis plant. Marijuana has compounds called cannabinoids. The two most active and most studied are THC and CBD. THC causes marijuana's high feeling. CBD may ease pain, inflammation, and anxiety without causing the high. There are two main strains of marijuana, sativa and indica. Sativa creates more of an energizing, cerebral high effect, which might look like this or this. Indica produces a more relaxing effect and is known for providing pain relief and muscle relaxation, combined with a heavy sedative effect, such as this or this. Because it contains higher levels of CBD, the indica strain is often used to manage chronic pain, nausea, anxiety, and appetite stimulation. There are also hybrid strains that contain various combinations of sativa and indica. Be aware of your state laws where you live. Marijuana is illegal at the federal level. However, each state has different laws about marijuana possession and use. Studies have looked at the possible benefits medical marijuana can have on cancer symptoms and treatment side effects. Symptoms that marijuana can help include nausea, vomiting, pain, inflammation, loss of appetite, and weight loss. Marijuana can be ingested in a variety of ways: dried leaves or buds for smoking, edible products like cookies, brownies, or candies, oil for vaporizing or mixing into hot drinks or foods, creams that can be applied on the skin, or sprays for your mouth. Using marijuana can have some side effects, such as low blood pressure, dizziness, fast heart rate, or fainting. And of course, the munchies, which can look like this, or even this. Marijuana can play a role in cancer care by lowering some of the symptoms of the disease and side effects of its treatments. While new data continues to show promise, we still need more research to better understand the full risks and benefits associated with marijuana use.
Well, of course, I've never done anything with marijuana. I don't know anything about it. I always just kind of thought of it as, it's this thing that smells like a skunk and you smoke it. Well, come to find out, that's a lot more than that. And the things that medical marijuana can do for a person, especially someone going through cancer treatments or severe pain or neuropathy or maybe medical disorders, post-traumatic stress. There's many, many, many things that medical marijuana can be used for to benefit a patient. And once I educated myself, listened to what my oncologist said, and took the recommendation to actually go through the process and be certified to receive it, go to the dispensary, learn about the different types that are there, and what would be best for me. Talking to the pharmacist there, they recommend what they think would be best for you given what it is that you're going through.
Would you let a first or second grader or any child use medical marijuana? Some family members in Oregon say yes. 7-year-old Michaela Comstock has an aggressive form of leukemia. Michaela is a registered medical marijuana patient. Her mom gives her the drug every day. Not surprisingly, there are some, including her father, who have concerns about this. I mean, after all, she's 7 years old. Dr. Sanjay Gupta joins us now with more, and we wanted to get your opinion on this.
Well, I mean, the first question a lot of people are going to ask is this even safe to do? And this ends up being the crux of a lot of questions surrounding marijuana. What is hard from a purely scientific standpoint is that it's an illegal drug in the United States, so it's hard to do studies on a drug that's illegal. So you often look to other countries to try and get data. And it's also, and here we're talking about a child, so it even makes it more difficult to do these studies in children. So we don't know a lot about the safety overall. We do know, in Michaela's case, there are 51 other children in Oregon who are also registered to be able to get medical marijuana. So she's not the only one. This is something that the doctors have obviously prescribed for not just her, but other people.
So tell us how marijuana is administered, because it's not like she's sitting down and smoking a joint, right?
Right. Well, there's all sorts of different ways as well. People are used to thinking of it that way, but it also can be in baked goods. It can be in a capsule form where you're actually taking some of the active ingredients. THC is the ingredient people talk about quite a bit. It can give you that feeling of being high, but it can also, it's a very good nausea medication, for example. And this is not anecdotal anymore. This has been proven in studies dating back to the 1970s. So people who are getting chemotherapy, for example, can take this to try and prevent the nausea associated with that.
So in Michaela's case, it did ease her pain, and some have even gone so far, I think she's in remission right now, right?
Right.
So some say that the marijuana helped kind of cure her leukemia. Is that possible?
Well, if you're talking specifically about its effect on the cells, I think that's harder to say. But all the other stuff, I mean, chemo is a very toxic drug, probably a lot more toxic than cannabis is. But all the side effects that you get from that, the marijuana, the pain, as you mentioned, just from the cancer itself, a lot of those types of things can be treated to some extent with the THC, the way that she was getting it. Now, doctors will say, are there other ways to do it that are less toxic, have a higher impact? We don't know. In her case, it seems to work. And as I say, in a lot of other patients who are young, we do know in people who start before the age of 15 and keep doing it throughout their life, even sporadically, tend to have an impact later on in life. They lose about 8 IQ points on average. Again, these are hard studies to come by. That was a study out of the Netherlands. But for adults who do this, at past age 15 or past adolescence, certainly, the long-term impact in terms of safety, there's not a lot really written to say that it's necessarily a problem.
Well, it's easy to sit back and criticize the parents in this case, criticize the mom, but when you have a 7-year-old kid in terrible pain, you want to relieve their pain.
Yeah, it's in, and I read the whole article, and I've been following the story. I don't know what the relationship is between the parents and the doctors here. There are clearly doctors in Oregon who think that this is a viable form of treatment. I'm not sure where the communication breakdown here is. There is even FDA-approved versions of this that can be given in adults as well and children. So, there are options for them. They're doing it a little differently. I'm not sure why that is. But as a treatment, though, in adults, I think we're beyond the anecdotal, beyond the sort of, there's actual studies. In children, it's harder to come by. But again, you are getting more and more children part of these registries.
So after all that, I thought, why not? I have nothing to lose, only to gain. It turned out to be a wonderful thing. Me thinking marijuana was this, oh my gosh, it's a drug, it's illegal, it's this, it's that, it's terrible. It has many, many, many benefits to it, many good benefits to it. And like everyone else, you think you know everything until you actually do some research and find out about it. So I did, and I've been on it ever since, and it has helped me a great deal with my sleeping, with my relaxing. And it's not smokable, it's not flower marijuana. I don't take that because I don't care for the smell of it. That still is the same. I mean, that hasn't changed, but there's many different varieties, and the variety that I chose and works the best for me is actually pills. They come in 30 capsules, or not capsules, 30 pills, and they come in different strengths. So you may take one during the day when you don't really need a high dose of it, and it'll have a certain amount of THC. And then you might take the extra strength or the high THC percentage at night, because that helps you be able to sleep and not be disrupted with a constant pain. So they also have gummies. I found them to be very beneficial as well. They each have different effects, and some take longer than others and that type of thing. But there's a lot more than just flour. There's roll-ons, stuff you can rub on your joints. to help with the pain. That is fantastic. It's kind of like, a BioFreeze or something like that, except for it's got the percentage of THC in it, and that really, really does help your joints or any pain that you might be having, your feet, your back, your hands, wherever that might be. And there are vapes. There are all different types. You have to check it out. You have to explore it and really kind of get to learn about it instead of just, prior to this happening, I was very closed-minded on what actually marijuana was. But after this, I've learned a lot about it, and I've discovered that, like I said, it's very beneficial to many, many people in many, many different diseases or illnesses or things that they're experiencing. So it was definitely worth checking out, and I'm glad that the oncologist recommended that to me, because honestly, that's been about the only thing that I can honestly say has helped with the pain and the neuropathy.
Hi, my name is Kim, and I'm a pancreatic cancer survivor, but that's not really who I am. I'm more than that. I'm a wife, I'm a mother, and I'm a friend. This is my story. October 2010, I went to my doctor's, and I said, I just have a stomach ache. So they sent me to a gastro guy, said, there's something there, let's just send you over just to be sure. It's 99% nothing, but I have to be sure. I go into Penn, they made me very, very comfortable. And he did the test, I was out of it. I get up, and the results come back immediately. And he says, I'm sorry, you have pancreatic cancer. I turned to my husband and said, we're gonna beat this. No matter what happens, we are gonna beat this. With pancreatic cancer, usually, or they try to operate. If you're not operable, you're not cured. You have to get to that surgery table to be cured. And when I was first diagnosed, my tumor was wrapped around blood vessels and arteries, and they could not operate. So the goal was to shrink the tumor. I chose Penn's Abramson Cancer Center because they had the trial. They had a trial protocol that I fit into. It was a little more rigorous, it was a little more intense, and it was gonna make me a little more sick, but I thought it would be worth it. And now I was in for a long journey. So now I had radiation and chemotherapy that I wore 24 hours a day, and with that, once a week, for I believe 6 or 8 weeks, I had the other 2 drugs, part of the chemotherapy, to get me, to enhance everything that I was getting, and hopefully it would shrink. So I called the surgeon at Penn, and he says, Kim, you're operable. Unfortunately, with pancreatic cancer, it's a nasty one. It has a tendency to possibly come back. In July, we found it. August 1st, I started another protocol with Penn. Only this time, because technology is changing daily, weekly, it's changing so fast that now they can offer me protons. Dr. Metz, my radiation oncologist, said, we're gonna get this. He said, this is nothing. This is just little. It's nothing like what you had last time. And anyway, to make a long story short, today I'm cancer-free. You need to be someplace that's going to treat your cancer. Penn treated my cancer. It didn't treat pancreatic cancer. It treated my pancreatic cancer. They offer the doctors, the support staff, the technology, the drugs, the treatment. But the cure is within you. I am the one that has to stay focused. I am the one that has to fight the disease. Penn is there to help. Penn is there to do whatever we need for our cancer. But the cure is within.
The look on this little girl's face just haunts you. At this point, she can't even hide her pain. 4-year-old Jessica Whelan has been battling an aggressive cancer affecting her nervous system for more than a year. After multiple treatments and surgeries, nothing helped cure her. Doctors now gave Jessica weeks to live. The toddler's father snapped this heartbreaking photo of his daughter so people can see the darkness of childhood cancer. He wants people to become more aware about the deadly disease and help support ways to fight it. Because his little girl, who used to smile, is no longer a fighter. The cancer won, and he wants to make sure no one else has to go through such heartache.
My wife and I had bought a fixer-upper home, and we were doing the work ourselves. We had moved in. We were probably about 95% complete. I was working on my front porch. I'd put some beadboard paneling in the ceiling, and I had stained and polyurethaned the entire ceiling, and then I was hanging my bench swing, and the painter's stool I was on flipped, and I fell. And I broke 5 ribs and punctured my lung. I was rushed to the hospital, and they did the scans and came back within 4 or 5 hours, said, "Mr. Lee, you have a lump under your breast." I was here getting a mammogram, an ultrasound, and I came back, I guess a week later, and had a needle biopsy, and it was confirmed that I had stage 2 invasive ductal carcinoma, breast cancer. I had a full mastectomy of my left breast. And then I started chemo in January of 2019. I had 4 rounds of chemo, which ended March 13th. And it was some pretty dark days in those several months that I was going through all that. It took a toll, and right after that I started getting a little my strength back, and I had a scan in May of 2019, and it's, "Mr. Lee, you're cancer-free."
So finding breast cancer in men or women early is always the key to treatment. The earlier we can find things, the smaller they usually are, and we can get a jump on the treatment and hopefully maybe even give less treatment, and that is the key. Just being aware and getting things checked out early to confirm that they're okay, or else knowing that we can get a start on the treatment and have the best outcome for that individual.
I don't think there were many words that you could say to me that were probably as pleasant. Maybe, "I love you," "Yes, I'll marry you," "It's a girl," "It's a boy," "You're cancer-free." I mean, it was a life-changing moment for me. Since then, I've been involved with American Cancer Society. I'm involved with Susan G. Komen, and I'm loving every minute of it. You know, and you can talk to a lot of people, but it made a big difference to talk to other men. And I'll say this too, the women that I know that had breast cancer have been very instrumental in just information and kindness. And I'm gonna tell you, they've been some of my best cheerleaders. You know, it's amazing. Once people know, or you meet these other people that have breast cancer, you're in a family, and it's special. It's something that I want to make sure that I spread the word that men can get breast cancer. I'm an example of it. And early detection is the key.
People associate breast cancer with women, but men can get breast cancer too. In fact, 1 in every 100 cases of breast cancer are in men.
Even though it is less common, breast cancer in men can be dangerous if it's not caught early. Our Max Massey sat down with a doctor from UT Health San Antonio who tells us it's a situation you should be aware of.
Well, they're surprised. Like, as you mentioned, they usually don't know that they could have breast cancer.
Dr. Kakamani and the Mays Cancer Center see about 500 new breast cancer patients every year. And of those 500, 5 are going to be men. But just like women, fighting breast cancer all starts with a lump.
It's usually painless, so it does not cause pain. Again, something that's important. If you think that, oh geez, it's not hurting me, it's not going to be anything, it usually does not hurt. Those are usually the signs and symptoms. You're not supposed to have other symptoms. You're not supposed to have headaches or shortness of breath or pain anywhere else. It's usually just a painless lump.
The good news is that Dr. Kaklamani and her team treat it relatively similar to how they treat women's breast cancer. The doctor tells me the prognosis is the same, and stage by stage is pretty similar, and the medications are the same. Now, there aren't exactly clear-cut preventative measures, but it's important that you're aware of any medical problems your relatives may have.
Know your family history, especially for men. It's very important that if they have a family history of breast cancer, especially if it was in female relatives that were younger, female relatives that also had ovarian cancer, those are signs that help us figure out that he may be at risk of breast cancer.
And if you do think anything is wrong, or if you feel what may be a lump, it's better to be safe than sorry.
The majority of breast cancer patients, whether they're men or women, are curable, and we expect to cure them. The important thing is that we catch it early. So that's why it's important, if you do get a breast lump, even if you're a man, please go to your doctor, have it checked out.
Max Massey, KSAT 12 News.
Odds of becoming an astronaut, 1 in 13,200,000. Odds of being struck by lightning, 1 in 576,000. Odds of dating a supermodel, 1 in 88,000. Odds of bowling a perfect game, 1 in 11,500. Odds of being trapped in an elevator, 1 in 24,528. Odds of catching a ball at a major league game, 1 in 563. Odds of an injury from shaving, 1 in 6,585. Odds of tripping while texting, 1 in 10. Odds of getting cancer in your lifetime, 1 in 2 men, 1 in 3 women.
It's up to us
To change the odds for our generation.
for the ones we love, for our future.
If you don't like the odds, stand up. Stand up to cancer.
So in closing, I just wanted to say a few things. If you have been through cancer or have received a recent diagnosis of cancer, whether it be breast cancer or whether it be colon cancer or whatever, make sure that you do your research. You find a good medical team that is going to take care of you and is going to see you through to the end. It's very important to have a good medical team. It's also very important to have a very, very good support system, whether that's family, friends, coworkers, whomever. Because, without your friends and family, and I don't know that I would have made it through the same way. It's not a death sentence. It doesn't have to be. It just depends on, you have to remain positive throughout the whole thing. You have to realize that there are resources out there for people going through cancer. One of the most beneficial things that happened to me was when I would sit during my chemotherapy treatments, there was a nurse navigator that would come to me that the hospital provided for me at no charge to me. And she had list upon resources that I could access, counselors, free medical rides. I signed up to this angel fund. That was a bunch of people all over the United States that would every month send me a little care package. They didn't know me, I didn't know them, but they'd send me a little package of gifts, just a little something to brighten my day and let me know that I'm being thought about and I wasn't forgotten. There are gift cards you can sign up to receive to help you with groceries, to help you with gas, to help you with necessities. There are so many resources out there. And this person came to me, like I said, I had no idea they even existed, and offered just this amazing amount of resources. So please take people up on their help. There was a food chain that started at my work to bring meals to me. Different people came with food, dessert, snacks, beverages, whatever stuff. There is support out there, and there are resources. So don't give up on the journey. Don't give up on what your end goal is, and that is to make it through this no matter what. And you have to remain positive. You have to have a good attitude. And there's going to be days that you're going to cry. There's going to be days that you're going to want to throw in the towel. There's going to be days you don't want to get up another day. You're just like, forget it. But you have to keep going forward. You have to keep moving on. Because when you give up, then it's all over.
This adorable 8-year-old was hiding something from her mother and father, even her big sister. For months, Chrissy Turner felt a strange lump on her chest. Each night, she went to bed hoping it would just go away. It didn't.
She came to me out of her bedroom. She said, "Mom, I've been afraid to tell you I have a lump on my chest and I'm scared." She had ghost white face, just that look of fear.
Her mom, Annette, was alarmed after feeling the large lump.
It was about that big around.
A biopsy taken at Primary Children's Hospital in Salt Lake City revealed the unthinkable: breast cancer.
You hear about breast cancer all the time, and you always see women. But to know that your daughter, your 8-year-old daughter, has breast cancer, never would have thought it in a million years.
It's very likely that I'll practice for the next 30 years and never see it again.
Learning that Chrissy had breast cancer was overwhelming.
My little girl is not supposed to have cancer. No. Yeah, it was, that was the hardest thing.
The course of treatment was radical.
Standard of care is complete mastectomy for this type of cancer, whether you're an adult or a child.
Our 8-year-old daughter is going in for a mastectomy. You can't even wrap your head around it. It's still surreal.
The day of the surgery, Chrissy put on a brave face.
When they wheeled her away, she was afraid.
Am I gonna live through this? Is everything gonna be okay?
Great news. The surgery was a complete success.
She was very lucky to not have the lymph nodes under her arm, had no signs of cancer.
Bless us with good health always.
Today, the Turners have a lot to be thankful for.
The cancer's all gone.
You have to keep fighting. And you never know how long that fight is going to be. But you have to fight. And, you know, I had to do it for my daughter. My daughter, when I told her that I had cancer, she thought that that was it. You know, I don't want you to die, Mom. I don't want you to die. Never thought of dying. That wasn't even an option. That wasn't even a thought in my head. I just did what I was instructed to do and followed the directions, went along with the treatments. Like I said, reached out to people, the resources, you know, counselors, anybody. There's lots of help out there for people going through cancer of all different types. And you need to get connected with those people. If you don't personally know of places, I don't know, the hospital provided me someone. So seek those resources out if they don't come to you and utilize them because you're going to need them. It's a tough fight. It's a tough battle. And, you know, the end goal is you want to make it out alive and get through it all. And that's what you have to keep remembering. And you can't give up. You just can't. You have to keep moving forward. And I wanted to also put out there that if you don't have anybody to talk to, you don't have anybody to confide in, any support system, please reach out to Michael Dane on his show. Complete a form indicating that you would like to get in touch with me, and he will provide me your contact information. And I'm happy to discuss with anyone or meet someone, talk with them, go through what I went through. I'm more than happy to do that. People were there for me, and I just want to pay it forward and be there for someone else. So that's a great way that you could get a hold of me, is via the Michael Dane, and then filling out form, and then he will let me know. The other thing I wanted to say is I don't really push people into doing things, but one thing I do want to stress is if you are a woman and you are in the years of getting a mammogram, please be sure to go and get your mammogram as it's instructed by your doctor. Don't put it off. Don't ignore it. If there's any preventative tests that you are, supposed to take, please do them. Had I not went there and did my regular mammograms, it could have been a very different outcome for me. So I just want to stress the importance of following your doctor's advice on your routine test to prevent cancer. Because, as I said, had I not followed through with it, my outcome could have been very different. So, thank you for your time, and I hope that something that I have discussed today helps someone in some way. And like I said, feel free to reach out to me via Michael Dane, and I will try and get in contact with you and, be happy to talk to you. Good day. Have a nice day.